Good morning to all. Myself T. Prabhu, Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore. Today we are discussing about case study of traumatic brain injury or craniocerebral trauma. Okay. So what is the craniocerebral trauma? The craniocerebral trauma is brain dysfunction caused by the outside of force, usually a violent blow to the head. Traumatic brain injury often occurs as a result of severe sports injury or car accident. Okay. So commonly 1 million cases per year in India. Treatable by medical professional, requires medical diagnosis, lab tests, or images often recur, whereas critical in case needs to emergency care. Okay. What are the symptoms of traumatic brain injury? The symptoms can be required medical diagnosis. Immediate or delayed symptoms may be include confusion, blurry vision, and difficulty concentrating. Infants may cry persistently or be irritable. Cognitive symptoms: amnesia, inability to speak or understanding language, mental confusion, difficulty in concentrating, difficulty in thinking and understanding. Then behavior symptoms: abnormal language and crying, aggression, impulsivity, irritability, lack of restraint, or persistent repetition of words and actions. Whole body: blackout, dizziness, fatigue, mood, anger, anxiety, apathy, loneliness. Eyes: dilated pupil, recon eyes, unequal pupils, GIT, nausea or vomiting. Speech: difficulty in speaking or slurring of speaking. Visual: blurred vision or sensitivity to light. Then temporary moment of clarity, balance disorder, bleeding, bone fracture, bruising, depression, loss of smell, nose injury, post traumatic seizure, ringing in the ears, sensitivity to sound, or stiff muscles. Okay, then what is the treatment of traumatic brain injury? Whereas the treatment process may be a first diuretic medication, taking a medicine that helps to eliminate extra water from the body. It helps to prescribe the treating of high blood pressure. Then therapies: rehabilitation, retaining the brain pathways to improve mental and physical functioning after illness. Cognitive behavioral therapy, a talk therapy focused on modifying negative thoughts, behavior, and emotional response to associate with anger management. To participating mindfulness, copying mechanism, and trigger avoidance to minimize destructive emotional outside functions. Counseling psychology, a branch of psychology that treats personal problems related to school, work, family, and social life. Next, what are the treatment of what are the surgery for the further management? Decompressive cranioctomy, surgical removal of part of the skull so that an injured brain can well without being squared. there is nothing but craniectomy. The craniectomy procedure for using a physician of MS neurosurgeon to provide a basic brain surgery or brain syndrome to remove the skull within the part to injure the brain with remove the part, then you have to make it the procedure and usually medical management to the further following like. So this is the traumatic brain injury or craniectomy procedure. Thank you.